Hi, and welcome back to This Week in Voice, the special healthcare series, episode 4 or 5. So this is a slate of 5 healthcare-oriented episodes of This Week in Voice taking place between season 4, which wrapped up earlier this year, and season 5, which kicks off in late August, leading us up to the Voice of Healthcare Summit, which typically takes place at Harvard Medical School each year. And this year, as we will announce tomorrow, we'll be going all virtual. And we're excited about it, but that's a sign of the times. This episode here will focus on the intersection of voice, AI, and health insurance specifically. And we've got a fantastic panel assembled to talk about that. And my name is Bradley Metrock. I'm CEO of a company called Score Publishing based in Nashville, Tennessee. We're not a normal publisher. Much of what we do involves voice technology and conversational AI. I'm pleased to be hosting the show. Let's take a look at each one of our panelists. And Mika, I'm going to start with you. Maaike Coppens, I'm going to start with you. We have 2 Mikas on this show. Maaike Coppens, say who you are, who you're with, what you do.
Hello, Bradley. So nice to be part of this. Thank you for having me. Us Maikas are very notorious to go into voice design. There's actually another Maaike Groenewegen who is also a conversational designer in the Netherlands. So a lot of Maikas going around in the voice world. And a bit more about me is I'm an independent UX and strategy consultant for voice and also a co-founder of Promptful. As such, I've worked with a lot of insurance companies, healthcare, and otherwise, both in US, Canada, in Europe. So glad to share my perspective on that as well, as it's a very important topic.
Maaike Coppens, thank you for joining us. We appreciate you making the time. We've got another Mika on this show, Eddy. Mika, say hello.
Hi, everyone, and I'm actually Mika, not to break the pattern,
okay.
but
no, that's even better. Thank you for being part of this with us.
Yeah, of course. Glad to be here. So I can give a quick intro. I'm Director of Clinical Product Innovation currently at UnitedHealth. Have been leading a couple digital health initiatives, including our work on voice assistants, and so I'm very excited to hear from the other panelists and engage in discussion today.
Mika, thank you very much for being part of the show with us. Next up is Audrey Arbeeny. Audrey, say hello.
Hi, everyone, and thank you, Bradley, for having me on. I'm Audrey Arbeeny, and I'm the founder, CEO of Audiobrain. And Audiobrain is a boutique company that does sonic branding. I've been doing sonic branding for 25 years, and I've had Audiobrain for 17. And what sonic branding is the art and the science of creating an intentional, integrated sound landscape for a brand and leveraging it across a multitude of touch points for a unified communication system. So our mission statement is, Audiobrain's mission is to advocate and promote the use of music and sound to promote well-being. So although we work in every single industry, from having done the Xbox 360 to supervising 9 Olympics for NBC, we also have a very deep passion point, and my biggest area of concentration is in healthcare. I have a background in that. I studied psychoacoustics, biomusicology. I've worked with kids that were deaf and blind and done music therapy. And that's the driving force behind my company. It's my passion point. I've been fortunate to have spoken up at Harvard Medical School last year and really advocate for these types of projects and initiatives. We've done surgical robotics, we've done heart health devices, and anything that promotes health and wellness is something that we're phenomenally interested in and are working in right now. So thank you very, very much.
Audrey, thank you very much for being part of the show with us, as always. Next up, we have Bhagvan Kommadi. Bhagvan, am I pronouncing that right? And you're on mute. You're muted.
Yeah, you're right.
Okay. Cool. Yeah, thank you for being part of the show with us. Tell us who you are, who you're with, what you do.
Yeah, so I have founded a AI startup back in around 2014. It was into it was called Architect Corner. We were looking at digital assistants, voice assistants, and recently I founded Quantica Computer, where we are looking at quantum AI, right? Looking at healthcare, looking at genomics. Currently I'm working as a director of product engineering at ValueMomentum. In ValueMomentum, we have a social network for doctors called White Coats, and we are providing a telehealth support to Practice Plus before COVID and currently during COVID. And I've published papers and presented in the area of genomics and biotechnology and diabetes, and I've worked with various clients in insurance and healthcare, like American Express, Citi, ING, Kaiser, and I have written some books related to quantum solutions, quantum AI, and also presented in the conferences, especially the voice related, like Avios, like Astricon. Currently, recently I had a ClueCon weekly where I talked about the AI and the voice, and currently my interests are in the area of explainable AI, conversational AI, adaptive learning, voice recognition, analytics, and also voice-powered business intelligence. And I'm currently being a board member for ACTA Scientific Medical Sciences, where I'm presenting scientific papers, like trends in healthcare, insurance. So that's the brief overview for me. And I'm also a member of MIT Technology Review Global Panel and Harvard Advisory Global Panel.
Bhagvan, thank you for joining us. And
Thank
great,
you.
yeah, great to meet you. And finally, we have Matt Sabolsky. Matt, say hello.
Hey, how you doing? Matt Sabolsky. I'm the co-host of the Voice of Healthcare podcast. Bradley, did I interrupt you?
No. Tell us,
Okay.
yeah, you're off and running. Tell us who you are,
Yeah.
who you're with, what you do.
Yeah, so I'm the co-host of the Voice of Healthcare podcast. Been running that for the last 3 years. Bradley and I started that in 2016, and it's led to some amazing outcomes, including regular annual conferences at Harvard Medical School, including the folks on this call and others who will be joining us. We've had fantastic conversations with folks across the United States and the world, including Eric Topol from Scripps Research, Mayo Clinic, and the CMO of Teladoc Health, Dr. Lou Levy. We've had Grammy Award-winning artists on the show, and we've been able to create and cultivate a community of people who are impassioned by changing healthcare as it moves from big box, large edifice to multiple spokes and nodes and constant connection, sort of mimicking the long tail of supply of Amazon. So we can sort of magnify the amount of people who are helped with a dwindling amount of people who actually do the work for clinical medicine. So it's actually nice to be a part of this. Been in healthcare for 16 years. I'm a psychologist by training. I have focused on human behavior modification and tech, consulting for firms out of the Bay Area, Boston, and DC. Currently focused heavily on finance and the consumer experience as well. And it's great to be here, Bradley.
Matt, thank you for being part of the show as well. So all five of y'all, thank you for setting the time aside and being willing to share your experience and your expertise with me and the audience. So look, this episode here is about voice and AI and health insurance. And it's my, I guess, perspective that in so many aspects of our lives, professionally as well as personally, this pandemic has served to accelerate trends that were already underway. We've seen it over and over and over again. Conferences needed disruption. Well, they sure got that. Restaurants needed to be able to serve people, and more flexible with delivery and also, take any sort of vertical. Hotels needed to be more hygienic. The way the world needed to get to and the way we were trending in many situations, that's where we've ended up. And so this pandemic, the silver lining of it has been acceleration. And so my question for y'all, and Mika, I'm going to start with you. We'll go through the same order that we did the intros. Share with us an aspect of your organization, your working life, or in your organization that has been impacted by this pandemic, and also how you view how the pandemic has impacted what was happening with the application of voice and AI to health insurance. It was already, there was signs that it was already on its way. But share with us your perspective on the impact for you personally, as well as what you think has happened in the marketplace with voice and AI and insurance.
Yeah, sure, gladly. And I agree with what you were saying, Bradley. It's definitely in a lot of verticals been an accelerator for innovation, which is always a good thing, despite all of the negative in this situation, obviously. In my business, the COVID has definitely been an accelerator in that it has prompted me to provide more content and training and workshops online rather than in person. So that was something that I'd been thinking about for quite a while already, but I never really got to it because always busy and on the road. And I would say thanks to the pandemic, I had a bit of time and also the need to really get that accelerated. So from that perspective, it really did kind of act as an accelerator. Then when it comes to companies I work with, I kind of observe two trends. One trend is where voice is still in the experimentation phase, where it is still within the innovation departments. In larger companies, sometimes budgets now get frozen because they need to get to the day-to-day and make sure that they go through that transformation that COVID now requires them to go through, rather than focus on really innovating projects, or which voice is for them at that point. And then there's other companies who are already voice mature or had already put a first foot into voice, that really saw the opportunity of the fact that voice could be integrated within the entire customer journey and could actually help them stay in touch with their customers throughout this pandemic, as they are no longer seeing them in real life. So I guess there's two trends, which is one where it's freezing up budget because we really need to tend to more pressing economic matters, and then accelerating for those that realize that it's actually an asset within the customer journey and can actually help them move through this pandemic. And when it comes to healthcare insurance, I think healthcare insurers, which I know of, have been at the forefront of this because a lot of insurance and a lot of healthcare is about servicing their end clients, and is about being able to get those end clients to understand their insurance and get more information about health, get more information about practitioners. So I think healthcare insurance and a lot of the actors I know have really seized this to embed voice even deeper in their customer journeys. And also not only from a very tight voice app perspective, but really from a very broad voice perspective within the customer journey, both as in intelligent IVRs, voice applications, obviously voice search, and really throughout the customer journey to get closer to that customer now that they are further apart.
No, that's excellent. And yeah, that's great perspective. Mika, I'm going to ask you the same thing. Share with us a way that the pandemic has impacted you and your organization, and your thoughts on its implications for the application of voice and AI within health insurance.
Sure. I would say that I agree with kind of echoing what the other Mika just spoke about. I think the pandemic has been, this kind of silver lining has been that it's really catalyzed not just telehealth and synchronous and asynchronous and, remote patient monitoring and care navigation and so on, but has really underscored the importance of payer-provider collaboration. I think I saw an article this morning, actually, half of US hospitals could be operating in the red by the end of this year. And, similar to Micah's experience, we've seen kind of two things. One, hospitals either being, so overwhelmed and don't have the appetite to take on additional risk. And so some pilots have been delayed. In other cases, provider groups are reaching out. They need help with it, especially surging, like Medicaid enrollment volumes as the unemployment population balloons and mental health issues come to a forefront. And they're looking for a remote care solution to enable, streamlined workflows for clinicians, as well as, better consumer experience and better patient experience. And so I think from, zooming in on kind of voice and more broadly remote patient monitoring, I think voice can serve really as kind of that digital front door or Trojan horse almost, where once you have voice-enabled devices set up in the home, those can connect to other smart devices that can then build a smart home, which is now, especially in the pandemic, a safer home and a safer place for patients to be. And so voice is really can be the gateway to that, to setting it up in the home, having your blood pressure cuff, your scale, your glucose monitor all attached, and voice is just nudging you to take healthier actions as a patient, and that data can be transmitted over to a provider and can help with kind of a virtual triage. Do you need to actually go in and see a provider? Can this be taken care of over a virtual visit, telehealth visit? I think it opens, this has really, accelerated and pushed a lot of these questions to the forefront, whereas previously it was, nice idea, let's invest in it. But now we're actually seeing quite a bit of movement out of, necessitation of the situation.
Yeah, no, that's excellent. Complete agreement. And Audrey, same question for you. How the pandemic has impacted you and your thoughts on the role that voice and AI can play within health insurance amidst everything that's going on.
Sure. So I think that, we've been pretty impacted. We're here in New York, of course, so we've been very impacted. But my business, we've had to make 5 recording studios remote at my composers' homes. So we haven't furloughed anyone because we had projects that were in motion, and we continue to do so. However, we have 2 clients that are in bullseye industries that won't be moving until next year. One is in the cruise industry, and we do a tremendous amount of work. So unfortunately for them, they're not doing anything. And then the other one is work that we do in sports. So sports is fairly, non-moving right now, some moving a little bit. So those have impacted us on one end, but on the other end, we have a lot of devices and a lot of products, and they're moving quite quickly. So again, to echo what was said before me, these things were coming, and we knew they were coming. We've discussed them over the past few years. If you talk about healthcare, the devices that have come out just in the past few years are phenomenal. And we've done the sound for those. We've done voice casting for the introductory videos, the training videos, and we've done like 3D tours and things of that nature. But this has really pushed it. So I think that a lot of our work right now is coming from products that are going to go to market and are going at lightning speed. And the ability to do that remotely, because we connected our studios, we got everything in order, has been a little challenging, but getting it in order, but we're okay doing it that way. Now, with regard to insurance specifically, the areas that come into play there are more on the, less on the, like healthcare as a whole is doing a lot of devices, fantastic devices that can keep people in their homes for many, many years. And I broke my toe. I made a video of my broken toe, and I did a telemed with my doctor. I was going to put music to it, but I thought that was a little inappropriate. But it saved me from going back into the city, and we knew what it was. It was, you know, it was clear as a bell what was going on. But with regard to insurance specifically, I found that there was a lot of bumpiness with the IVR systems, because I don't think that they, to a certain degree, they can take you through the road to get to what you need to. However, I don't think they were quite prepared for the load of volume that was going on. So you'd go through the IVR, and then to get to a point where it said, we have, 295 people ahead of you. Please leave your number. We'll get back in touch with you. But where I do see changes there is that we're doing a lot of work in the empathy side. And I'm doing that with my own customers. It's like some of them, it's like, forget it. Their budgets are frozen. But I want to stay connected with them. So I'm doing the care, and I'm doing the staying connected and the empathy, and sending them articles and things that relate to them. And I think that that's what's happening here too, is that we're doing things where we're taking things and we're revoicing them with a more empathetic voice. We're recasting them. We're helping people work through their IVR systems to have a different tone. And people are changing the nature of what they're recording. For example, like Cigna 5 years ago had a video ad called, why choose Cigna? And 17 hours ago had, what's a Medicare supplemental plan? It's a different tonality. It's more customer centric and care centric. And that's what I think's happening now.
Yeah, that's great. I appreciate that. And Bhagvan, to you, so you got a different line of sight on all this. Share with us, not only how the pandemic has impacted you and your organization, but also how you view how it will impact, how voice and AI will impact health insurance amidst the pandemic. And make sure you speak up a little bit as well.
Sure. So I think most of the speakers have covered, but just to take a step back and see what impact COVID has done. There were massive casualties, right? The medical infrastructure was overwhelmed with the requests coming in from various corners, right? And there are potential second-order deaths, and the chance that we might have a second wave, right? And it crippled our economic life. And to give some of the instances, employees were unable to visit insurance offices, right? The industry operations and sales in healthcare and health insurance almost halted, right? And there was no insurer staff ready to help out people, right? And there was difficulty in offering services like in-person advice or even at-home medical examination, right? Because of lockdown. The people are unable to move, both in Asia, Europe, and North America and South America. And there was no way to obtain the previous medical and insurance history, right? And applications were dropping down. The insurance premiums were hiking up, and the annuity was reducing. And of course, the declining underwriting profits and investment returns were plummeting. and the healthcare coverage plans and policies. Pretty much everything got changed. Right? And if you look at the pension accumulations, right, they started showing uncertainty because people were absent from work, layoffs, and partial employment. And there was a surge in claims also, insurance claims, due to COVID-19 related mortality and sickness. So having said that, both in Asia and Europe and various other geographies, there was a focus on digital assets, right? Enhanced information security, creating immediately a remote working infrastructure, coordinating a war room operations, right? Increased demand for pandemic-specific coverage and heightened insurance awareness. The focus was more on awareness. And of course, insurers extended the days of grace on due premiums as a goodwill measure. Some banks and financial companies have declared the financial moratoriums, right? And there was a proactive offer of cash value loans, right, from insurer. And there was a delay in pension contribution for the furloughed members. And of course, the COVID-19 testing was very expensive. In some of the areas, the testing was not covered by the insurance. Now, coming to the voice AI, there was clearly a rise in telehealth services, right, in US, in India, in Asia, in Europe, for addressing uninsured, underinsured, right? Even doctors started using, like I was reading about Sanofi, using virtual medical representatives, having appointments with doctors. So pretty much a virtual working model for the whole ecosystem, covering the healthcare players, the health insurance players, pharma companies, working together, right, and creating almost like a war room operation. So you had artificial intelligence-based interactive tools like bots, assistants, robotic process automation, video chats were happening, and mobile apps were gaining traction. So all this was happening within 2 or 3 months, right? Nobody thought we'll test our digital backbone, right? If you visualize the whole world's internet backbone as a digital backbone, nobody thought we will test it out, right? Most of our people were sitting at home, right? You getting up in the morning, wherever you are in your time zone, you are pretty much testing out, right? First 2-3 hours, you were just on the video chats, you were just on the audio chats, right? You're calling people. And also the bots and assistants. And they'll also focus on risk classification and fraud detection in business and claims, right? And along with the machine learning, the straight-through processing was incorporating optical character recognition, natural language processing for automated document ingestion in new business and claims. And health insurers, like I was mentioning, were waiving costs on COVID-19 treatment, like for example, Cigna, right? And Aetna was waiving cost sharing for inpatient admissions. And Cigna was also looking at digital screening tools like symptom checker to help early infection detection. Aetna was providing a free virtual doctor access. Another important aspect Kaiser was looking at was the mental health, being most of the employees who are working in the work environment or going out or traveling are now sitting at home for almost 3-4 months. So Kaiser Permanente created a mental health app to ensure, to relieve stress, right, to have normal life, to have good fitness programs and good health during this lockdown, where you can maintain your stability and mental health. And also Medibank was creating vital aid cost absorption. So if you observe most of these players like Aetna or Kaiser or Cigna or Medibank, look at even healthcare insurance business, this is a strategic inflection point, right? Not just digital business, not just AI, right? For the whole healthcare business, it's a huge inflection point. And clearly, they're focusing on how to win this particular battle against COVID-19 through agility, innovation, customer engagement, employee motivation, and swift technology option, right? I've never seen in my last 4 decades the technology adoption being so swift that even my parents and children caught on to the digital world. Like my second daughter, who is who is doing her 7th grade, picked up Zoom and started doing online classes, started doing Google School so quickly, right? So that's my view from this side of the world.
Yeah, no, that's excellent. And as you sort of alluded to, it reminds me of something that someone told me earlier this week who works in healthcare. They said, if you're not working on COVID-19, you're not working, which I thought was pretty interesting. There's such a galvanized force of resources on this, and you spoke to that and spoke to it well. Matt, same question for you. How has the pandemic impacted you, and how do you view how voice and AI will reshape health insurance?
Right. So I've been asked this question a few times. One of the answers I like to give is relative to a lesson I learned when I was 24, living in Cleveland at the Cleveland Clinic, doing some work, finishing up some graduate work at Case Western. And there was an attending and a resident having a conversation about a particular topic. The resident was uncomfortable about a procedure she was about to embark on. And he looked at her and he said, sometimes you have to start before you're ready. And for some reason that stuck with me, probably because of the emotion of the moment, but also how relevant it was. For COVID-19, when it comes to healthcare voice and AI, these things we had been talking about were developing. And we were excited about the incremental changes that were coming and the adoption rate. And then all of a sudden, COVID-19 hits. And so we're having to accelerate that, right? Because there's a need all of a sudden. And we're doing it largely before we're ready. But if we look at the history of humankind and innovation, sort of our largest accelerations of adoption as well as ideas and implementation of those ideas have happened during a time of need or even dread. Even just looking at what they've been able to do with vaccines lately has been sort of, in my mind, mind-blowing. So as far as AI and voice is concerned, I think it's important to think about these tools as, yes, as many of the folks on this call have mentioned, as an active tool, right? Me as a patient interacting with it, me as a provider interacting with it. But I think something that is really interesting that I believe will accelerate even faster from COVID-19 and the pressures it's put on us is sort of this passive engagement that voice and AI can have with providers as well as patients. Yes, reminders are great, but what if the microphones were specific enough, and I don't know if Audrey's encountered this at all in her work, but these microphones are specific. The technology, in order for it to decode what it's hearing, is very specific too. I remember being at a conference, for example, at Carnegie Mellon, and an engineer had said he has developed a protocol in order to diagnose what kind of appliances you have in the home based on the sound they make, or how much water is leaving the home when you flush the toilet or when you run the sink, even to be able to measure gallons by doing so. He said the applications are really interesting. Imagine that for healthcare. It can hear when I open up the refrigerator. It can hear when I open up my pill bottle. It can hear when I flush the toilet or when I urinate, how many milliliters I'm urinating if I have a condition that needs to track that. So I'm not necessarily actively engaging in it, but it's passively monitoring me. And hopefully that information goes into a database and can be utilized by a provider. So I believe the passive adoption of these tools, and of course some of the changes we've seen lately in initiatives with Haven and Atul Gawande, as well as other banks and retail pharmacies getting involved, will be a place for us to help us just with chronic condition management, but also managing something like a pandemic, right? Easy contact tracing without me giving up my liberties to do so. Recommending based on symptoms of my behavior alone that we've used data to uncover, perhaps I need to go see a physician or maybe have a web call to look at a condition I might be developing and that I'm unaware of, sort of preventive medicine on steroids, if you will. So that's my take on COVID-19 and what's happening with technology is before we ever were ready. And when we were just celebrating some of these early wins, all of a sudden the pressures on everyone on this call become very tangible and very real. How do we connect with the patient when they're not walking into a physical space anymore? How do we serve them? How do we keep our businesses going, right, to serve them and keep the missions open? And the things we're going to uncover after the fact are going to be revealing and probably really provocative, and I'm looking forward to the future.
No, that's great. I appreciate all five of y'all sharing your perspective. all of y'all spoke to it in different ways, but Mika and Bhagvan definitely talked about, and Matt, you did as well, the sort of this passive adoption of the tools, and Mika spoke about the smart home and things that you'll have in the home that will make it easier to not have to go in. And I was struck by you talk about Carnegie Mellon. So Carnegie Mellon was at the forefront. There were some others doing work on discovering that there's something about your voice that changes when you get this disease, and they have figured some of it out and some of it still remains. But when you're talking insurance, you're talking prediction, and you're talking getting out in front of things. And to the extent that voice and AI can play a role with preventing you from sitting there on a ventilator in a hospital somewhere, and on the front end, the very first couple of days you show symptoms of COVID, voice assistant hearing you talk and say, hey, you got a problem, and being able to deal with it much quicker. To me, that's what it's all about. That's the promise of voice and AI and health insurance, is that passive, that listening, that context, that getting out in front of things. And all of y'all spoke to that in different ways. I'm going to go in reverse order, and I'm going to ask each of you to name one hurdle that still remains for applying voice and conversational AI to insurance. And then we'll go in the original order, and I'll ask each of you to provide briefly a trend that you expect to play out in closing the show. So Matt, I'm going to start with you, and we'll go in reverse order. Share with us a hurdle, given everything that everybody just said about the promise and the things that they're seeing play out. What's one hurdle that's in the way of greater adoption of voice and AI with health insurance?
Well, I think the consumer, especially the healthcare consumer, rightly so, should be obsessed and is obsessed with privacy. And I think that in giving the consumer or the beneficiary some confidence that having a smart speaker in the home, let's say, or maybe a listening device on the mobile phone itself, or the awareness that that mobile phone is sort of monitoring them, that their information, their data, their home behaviors are protected, so that they do not feel as if they're being encroached upon, but they see it as a benefit of being connected. I think it's a huge barrier, and it's perception. And perception is everything when it comes to consumption. I think perception is everything when it comes to trust. And in this case, that's a massive barrier that I think all health insurers or any insurance company that would use one of these tools has to absolutely focus on first and foremost.
Excellent. Yeah, completely agree. Bhagvan, same question for you. What's one hurdle that's in the way, whether you want to talk up privacy or whether you got something else on your mind, a hurdle in the way of greater adoption? And you're on mute.
Yeah, so one of the challenges, right from the inception of the AI, the conversational AI, right, if you look at, was the persona design. So many of you, I don't know how many people remember the old GPS. Nowadays, everything happens with the mobile phone. So we used to have old GPS, Garmin GPS, where you configure the persona. So there used to be a lady voice and a male voice, and a Spanish human voice. I remember when I was a student in Georgia Tech, I used to drive. So the persona which I used to pick up was the lady's voice, which was not Spanish and it was not male. And I used to like that voice. When you have to turn right, you have to turn left, and then there's a highway, there is a toll gateway. So the persona design of a chatbot, right, or a digital assistant is very key. And a bot's personality, and what is the language, what is the accent, right? And also the tone of the user's experience, right? And it's very important how the user experiences the discussion or conversation with the digital assistant or chatbot. So this has been what you call ignored right through, right? And most of the time we had a digital assistant, we didn't focus too much on the personal design about the chatbot, because in the COVID, especially the COVID scenario where you don't have many people to interact with, right, in person, the digital assistant or the chatbot impacts on your what you call mental health or social life or in conversational skills also. And some of the things which are similar to the non-speech or slightly related to the tone or voice patterns. Right? You look at the tone, rhythm, volume, pitch, right? These were focused little bit. Like for example, IBM Watson was doing some research and improvising in terms of analyzing the tones, rhythms, values, pitch. Currently, there's a lot of research going on. The person's health is measured by these voice patterns, and they are analyzed to diagnose a variety of conditions. So especially in a telehealth scenario, these what you call underestimated research areas like voice patterns, the personal design, are huge hurdles now. And especially there was another like change in the voice tone or cadence. Apparently, is a prediction for high blood pressure or a stroke or a heart attack. Right? This might look like slight exaggeration, but the current research shows that there's immediate change in the voice tone and the cadence. Right? Similarly, on the having an active lifestyle, right? There's a proactive AI-driven social robot called LEQ, which is coming up. There again, the person or design, how the chatbot is, who is the chatbot, what's the chatbot's gender, right? And also the availability of the virtual assistant and the behavioral modification activities, the impact on social life. Right? So these are the huge hurdles currently in the conversational AI related to healthcare, related to health insurance, or any other vertical. Right? It's not just healthcare. These are the challenges which currently which conversational AI is facing.
Excellent. Yeah. So we've got privacy and we've got design of the personality of the assistant, both on the board. Audrey, a hurdle that you see in front of greater adoption for voice and AI with health insurance.
Well, two of them was said already, so I won't even go there. But another one is financial, and the financial investment, you know, that we make. So like Mika, the role that Mika has, that's a really important role, those innovation roles. Will they continue? They're vital. But at the same time, the health insurance companies, you know, it's expensive to do some of these things. When we can get to a point where, like you were saying, which I think is just, I can't wait, I study it, where it can sense by my emotion or change the tone of my voice what's going on with my body. These things require funding. So will the funds be there for either the insurance companies to continue down those paths, which are vital to move those things forward, or will the outside developers who are doing them be able to stay in business long enough and get funded to be able to continue their work? Because with that, the opportunity is endless. But I have a feeling that, you know, there's a lot of tight budgets right now, and it's going to be interesting to see which companies can sustain this or which companies can fund this. But for insurance companies, I think that innovation and bringing those things will be an outlay at first, but a 100-time reward that comes back.
That's excellent. Yeah. So we got privacy, we got design of the personality of the assistant, and we've got funding on the board. The three pretty big hurdles. Mika, your thoughts on a hurdle in front of greater voice AI adoption? You choose any of these three, or are you going with a different one?
So I would say, in addition to kind of the technical hurdles or challenges and operational challenges, definitely hear you on, you know, you need to demonstrate the hard benefits of these innovation projects. And as you said, hopefully these roles stick around so we can overcome some of these barriers. But I would also like to highlight kind of what I would categorize as almost a usefulness. And this is maybe tied to design, maybe tied to the end consumer experience. But, you know, there was I think a VoiceBot report that came out in October of last year that showed, you know, 7.5% of US consumers are using voice today for healthcare applications, like looking up medical information, finding nearby care, and so on. But over 50% would like to. So there's a significant gap. there's a 7x user base that are ready to use voice and use these platforms to help navigate care. But yet we see limited adoption, and there are tens of thousands of, Alexa skills and more Google Actions. And I don't know if Cortana, is doing anything, but so why is there this continued gap? And I think one that points to kind of the usefulness of these skills, as long as the user experience of calling in and talking to a live human or going online and searching for the answer yourself is better than talking to Alexa or Google, then adoption of these voice assistants will be gated. And so I think there's a usefulness and kind of design challenge there.
That's excellent. Yeah, so we've got 4 big hurdles. We got privacy, we've got design, we've got funding, and now we've got adoption issues, all 4 of which are fundamentally important. Mika, same question to you. Your thoughts on a hurdle that's in the way of greater adoption?
Yeah, sure. A lot of them have already been surfaced, obviously. My main question mark is around awareness of future ROI. So as we know, any sustainable business makes decision based on ROI or possible ROI. And when it comes to voice, the ROI is a lot less immediate and tangible than for any other interface, because obviously if you look at social media, if you look at websites and all of the analytical tools that go with it, from click 1, a business can know how much money it just made thanks to their presence on that interface. When it comes to voice, that's a lot less obvious, a lot less blatant. It can be measured with something like a drop in actual calls to human agents for IVRs. It can be measured with like success rate, etc., but still key business people don't really, in my experience, see the numbers, the bigger numbers behind it. And that's also, Mika said, we have this gap between users being ready to use voice for their care, for their insurance journeys, and then actual possibilities that they have today. And I think that has also to do with that lack of awareness that ROI is perhaps not immediate, but as Audrey stated so well, the return will be like 10,000-fold, not only from a dollar perspective, but from a being there for your customer perspective in times of need. And that necessarily brings ROI dollar-wise later on at a time that you can't necessarily measure, but that is there. It's not only about getting the dollar on the click, it's about creating the awareness for the long term. And I think voice is very good at that if it's given the opportunity.
No, that's great. And so, yeah, that's 5 interesting hurdles that were all said there. And so we've got time running short. So we're going to call an audible here. We're going to go through the original order. We're going to go Mika, Mika, Audrey, Bhagvan, Matt. And I'm going to ask you to close the show by getting your crystal ball out, put your Nostradamus hat on, and give me one sentence on a trend that you expect to play out over the second half of 2020 into the first half of 2021 with regards to voice, AI, and healthcare. Mika, I'm going to start with you.
I think that voice AI and healthcare will continue to play well together. And it is my hope that in that play, empathy plays a central role, and that the trend to focus on accessibility and inclusion will continue both in healthcare and in the rest of our lives.
Excellent. Thank you. Mika, one sentence on a trend you expect to play out over the second half of 2020 into 2021.
I would say a focus on enabling remote patient monitoring in the home.
Excellent. Audrey, one sentence, a trend you expect to see play out over the second half of the year into next year.
I think taking voice AI in healthcare combined with empathy, humanity, and humanizing these products, I think this is going to be the biggest singular growth area over that period of time.
Excellent. Bhagvan, one sentence, a trend you expect to play out over the second half of the year into next year.
I would see an AI clinical assistant, right, which can provide a real-time information based on the patient's medical records and the clinical support for both doctor and patient to make a decision. Right? It's not just the pandemic, it's going to be a second wave where it will be a lot of respiratory diseases which are going to come. So I think AI clinical assistant with the telehealth solution will play a very important role.
Excellent. And Matt, last word to you, one sentence, a trend you expect to play out in voice and AI in healthcare second half of the year into next year.
I agree that the humanization of these tools will become one of our primary focuses into the future, but I also think that the way we recruit patients and give them access to care will become ever more primarily done through voice and AI.
This is excellent. So Maaike, Mika, Audrey, Bhagvan, Matt, thank you all for your time today. Thank you for being part of This Week in Voice, Special Healthcare Series, Episode 4. For me, Bradley Metrock, thank you for listening or watching if you're watching on YouTube. Until next time.